Hi, I'm Dr. Christopher DuCoin. I'm professor of surgery at the University of South Florida. I'm division chief of GI and general surgery. And at Tampa General, I'm the director of the Digestive Diseases Institute. But first and foremost, I'm an esophageal surgeon. We wanted to make this video to take some time to explain some of the processes through clinic and your hospital stay, as it can seem overwhelming and even confusing at times. I want you to know that when you come to clinic in the outpatient setting and you see me, I've already reviewed your chart in detail, I've gone through all your tests and objective data, and I'm working on a surgical plan. Please bring your questions. We're going to spend our time and answer them. You're going to meet a lot of people on my team too. You might meet medical students, residents, fellows, or what we call mid-level providers, which are APPs, such as nurse practitioners and physician's assistants. I want you to know I make all the critical decisions and I do your surgery. Once you come into the clinic and we formulate a surgical plan, you'll be able to go home. My team will call you later and work on scheduling an operative date for you. Now, once we have that date picked, it's usually not until the day before the operation that you actually figure out when you need to come into the hospital. We'll ask that you show up to the hospital 2 hours before your operation, but block out that day before as you might need to travel. Now, once you come into the hospital, I will see you before your surgery. I'll meet you in the preoperative area, go through your consents, make sure you're comfortable, meet any loved ones you want me to speak with. I'll be with you clearly through your whole operation, and afterwards I'll come out and talk to your family. Usually you'll get a private room in our hospital. Your hospital stay is almost always 2 days, so the day of surgery and the day after surgery, one night. I want to observe you for at least 24, 36 hours before you can go home. And before you go home, I'm going to get what's called an esophagram or an upper GI. It's essentially an x-ray that really shows that everything I did is just right before you go home. I want to send you home in the safest way possible. Your diet. On post-op day 1, after that upper GI, we're going to move you to what's called a full liquid diet. So you can have protein shakes, smoothies, maybe even pudding and jello. Liquid, we're going to do that for 4 days. So post-op day 1 through 4. After that, we're going to move you to what's called a soft diet. Usually the consistency of like eggs, grits, mashed potatoes, things like that. You can even get the flaky fish. We're going to do that from post-op day 4 until you come back and see us in clinic. That's usually about 2 weeks. All right? The things I don't want you to eat: no bread, no meat, and no uncooked vegetables. Those are just really robust food, and they might get stuck or inhibit the surgery we just performed. Any medicines you're on, we're going to look at those at that 2-week office appointment and see if we can take you off them and how you're doing. Regarding physical activity, no heavy lifting for about a month after surgery. That's about 20 pounds. But we want you up walking around with good cardiovascular activity. All right? When it comes to showering, you can shower the day after surgery. On your incisions is going to be glue, surgical glue. That's it. It's going to come off in about 4 weeks after the procedure. So showering is just fine. Now, what we don't want you to do is to go into a tub or submerge yourself. Again, while you're in the hospital, you're going to meet the medical students, residents, fellows, but I'm making the decisions. All right? So that should summarize your office visit and your hospital course. If you have more questions, please reach out. We're happy to answer them, and I feel privileged and blessed to take part in your care. Thank you for trusting me, and I can't wait to meet you.